So honest, informed consent. It's a critical for your success. So I'm going to talk about the membrane, what could happen. I'm going to talk about sinus infection and what could happen. I'm not going to jump over those topics. I'm going to talk about these two elephants, and I'm going to talk in detail. I'm not going to scare the patient, and I'm not going to talk about death, because death doesn't happen. But I'm going to talk about these two occurrences, because membranes can tear, membranes can perforate. You may even need to abort. Sinus infections can happen. Why? Because they do happen, 5 to 10%. The sinus is not a very well-drained space within the skull. It has the middle meatus, it has your osteotomy and your sinus lift entry. No, there's not too many ways to drain. Maybe there's a pre-existing infection there already. You heard about sinusitis. So we have to communicate with our patients that these things can happen. So I'm going to prep my patients for these two scenarios. If the membrane tears, for the most part, it can be repaired during. If there's a minor tear, and tears happen not because you're a bad doctor, they happen because the membrane is very thin. Sometimes it's scarred. Sometimes it just tears. It's just so thin. And that's why I like you to start with thick membranes. So if the membrane tears, you will have to abort. So I tell my patient, if that happens and it's not repairable, what will close up, there's not going to be any harm done. It's going to be a setback and a delay in your treatment. We'll have to wait at least 2 to 3 months, let it heal. I'm trying to be conservative. Some wait, 6 to 8 weeks. I like to wait at least 3 months. We go back in there and we have another chance to do it and succeed. If the sinus gets infected, there's no point in keep changing the antibiotics. An infected sinus graft will not recover. If it recovers, it's one of those miracles you read about in the Bible or the New Testament. It doesn't happen. And I'm a pretty positive person, but when your bone graft is infected, it didn't work. So you need to go back in there as soon as possible. Act swiftly when you deal with complications, remove everything, flush it out, infection is gone. If you're not treating it, or if you keep changing the antibiotics, your patient will go from bad to worse to hospitalized. We don't want that. So what do? We diagnose a sinus infection. I'm not talking about inflammation. That's normal. So that's very, very important. Okay. Now, what do you need for sinus lifting? Okay, you need to be prepared. You can't just show up and do a sinus lift with curettes from your hygiene kit. You need to have dedicated instruments, and I'm just going to share with you the list. You need a universal surgical kit, obviously. You need a sinus lift kit, which is osteotomes for the crestal, or curette kit for the lateral. You need the bone graft. I use BIOS exclusively for sinus lifting. Why? Because I've been using it for 25 years. It works great. It's opaque. It has enough substance to support the membrane. It looks nice. It's radio opaque, and we see it radiographically. Plus, it's the most researched bone graft material for sinus lifting. Do other bone grafts work? Yes, they do. Do I use something else? No, I use BIOS, and I mix it with PRF, and I mix it with metronidazole. Collagen membrane. I always use it for lateral window. It's called the Biomend Extend. It's by Zimmer. I don't have any conflict of interest here. It's just what I use. Doctors wanted to know. You need to use a resorbable membrane on the window once you did a window approach. I always have a collagen plug if I wanted to cushion the membrane for a crestal sinus lift. So I use either collar plug or gel foam, or when I lift the membrane, I use the collar plug and gel foam to tent the sinus membrane. I'm going to show you a case for that as well. Plus, you need to have the right sutures. If we're doing a lateral window, I'm going to be using Gore-Tex, mostly for lateral. But if I'm doing just a crestal sinus lift and I did a flap, I'm going to use GAT4O, and I'm going to have the post-op instruction sheet and share the very important instructions for it. Now, medication regimen is critical. This is where a lot of dentists fail. 8 medications for sinus lifting, assuming no penicillin allergy. I prescribe Augmentin 875 twice a day, 10 days. Start 2 days before, minimize infection in the sinus, minimize anything that can potentially infect the sinus. Patient is already pre-medicated on the Augmentin before. Make sure the patient is taking probiotics because it kind of wrecks the stomach. For all sinus lift cases, whether it's crestal or lateral, I use some form of sedation. Unless the patient is like, I don't need it or don't want it, then it's rare. I prescribe Ativan, which is lorazepam 2 milligrams, 1 tablet 1 hour before. And I like to augment this with nitrous oxide. It's optional. I like to use it, at 50, 60%, which is kind of getting close to the maximum, which is 70%. We're getting the patient comfortable enough not to care about the procedure, not to care about the tapping. The reason I do this, it's number one for the patient. Second, it's for me. I need my time. I don't like to rush things. I like to make sure that we do it very carefully and that I have good visualization. I don't like to, have another patient booked right after where I have to rush. What if we have a complication? So I take my time. Sedation is important. Following the procedure, I keep my patients on 600 milligrams of ibuprofen every 6 hours for at least 2 to 3 days. Around the clock, be ahead of the pain. There's a lot of inflammation. There's a lot of swelling that happens mostly from a lateral sinus lift. And I have them combine with the ibuprofen, they combine it with acetaminophen, 1,000 milligrams, which is basically 2 extra strength Tylenol every 6 hours. So they take 3 Advil, 2 Tylenol every 6 hours, no matter what. Now, at nighttime, they can take away 1 Tylenol or take all the Tylenol away, all the acetaminophen away, and replace it with Percocet. So I'd like them to have some form of narcotic. Be careful what you're prescribing, who you're prescribing for. Here in the United States, very strict rules. You don't want to give a patient more than 3 days of supplies of narcotic medications. Follow the rules. Now, even more strict. We are no longer giving prescriptions. Everything is done through email and e-scripts, through specific portals, actually much better, much faster, and much safer, and helps to prevent abuse and confusion. For every sinus lift, I prescribe over-the-counter or recommend over-the-counter Sudafed, and they just take it preventatively for about 2 to 3 days. And if they feel very congested, they'll keep taking it for a whole week, but most patients don't need it more than 2 to 3 days. It'll minimize the bleeding from the nose. It'll minimize congestion or the feeling of congestion. And for some patients, I'm also prescribing a Medrol dose pack, which is a corticosteroid taken for about 6 days. Most of the pain comes from swelling. That's what's kind of dramatic, more in the face. And yeah, it's going to happen. Your patients are going to swell. They had surgery. They're going to swell. So make sure that you are prepared with those 8 medications. You don't have to use all of them. You want to look into what allergies they have, medical contraindications, what other medications they have. Be a real doctor. For most of my patients, they're getting up there. They're 50, 60, 70 years old. We get medical clearance. If they take medications, even somebody taking Celexa, I'm giving them a sedative. I'm going to get a medical clearance and inform the physician about what they're going to have. Okay, so take a screenshot and study those medications. Okay, so let's start lifting, guys.